Dr. Justine Miller is joining us today, who's one of our ENT experts. Justine, I wanted to ask you some questions about sore throats. I get a lot of patients who come to me about a sore throat, and I always try and explain to them it's not just as simple as just give me an antibiotic, I've got a throat infection. Sore throats can actually be a little bit more complex. What sort of things should doctors, or what sort of things do we think about when a patient says I've got a sore throat?
So the most common reason why patients present with a sore throat is actually an infection of the tonsils. The tonsils are sort of the first line of when patients breathe in or swallow in the mouth. They're the first line of their immune system. So what can happen is that bugs and things can get lodged there, and then they can cause an infection. And they have little things called crypts. So the little bugs live actually within the tonsils and form a little community in there, and then they become infected. So often patients that present have tonsillitis. What people don't understand, or often don't realise, is that you don't just have tonsils in the back of the throat, you have tonsillar tissue at the base of the tongue. So you've got what we call lingual tonsils. So sometimes patients, when they open their mouth, look completely normal, but they've actually got an inflammation of the lingual tonsil. The other thing is something called acute strep throat, where basically a bacteria called Streptococcus overgrows, and often we see this in patients that are a little bit stressed, a little run down, and then they get these infections. And basically what happens is these bugs sort of live there normally but at a very low level. When the patient becomes unwell or just generally not a little bit immune suppressed, that's when they kind of grow out of control, and that's when they get a really sore throat.
If you don't treat a strep throat, is there any potential complications of that?
Yeah, so strep throat can lead to other complications such as problems with the heart, problems with the kidney, and even problems with the brain. They've got, do you want me to tell them?
Rheumatic fever, is that what you're talking about?
So there's rheumatic fever, there's PANDAS, there's glomerulonephritis. And
big fancy terms.
Yeah, very fancy names, but basically what happens is that the body's immune system starts to attack the bacteria, and then it thinks that the heart is the bacteria, so it starts to attack the valves of the heart, and it can cause severe problems with leaky valves in the heart. And it can also start attacking the kidneys, thinking that the bacteria in the kidneys when they're not, because what happens is it's kind of what we call like an autoimmune almost disease, where the body attacks itself thinking that it's bacteria.
So it is important that we do actually look at patients that have got sore throats. In my experience, I've also found there are other causes of sore throats when you put your thinking cap on and, you know, the throat looks okay. You know, like reflux or drips at the back of the nose. In your experience, what sort of other things might actually cause a sore throat?
So as far as patients often complain of a lump in the throat, and that's typically what we call globus pharyngeus, but basically that is often caused by a combination of things, of what we call postnasal drips, so it's allergies and things like that causing a dripping down in the back of the throat. It's dripping onto the larynx, which is the voice box, and then you're constantly clearing that up, which irritates the throat. The other thing that can happen is you can get reflux, which affects the back of the larynx as well, and that reflux is basically acid coming up from the stomach up to the larynx and causing burning of the larynx. And that gives you that sore throat. So actually treating the nose as well as treating acid reflux can really help patients that have that constant sensation that they've got something in their throat.
So patients do have a sort of a chronic sore throat. What would be your best advice to them?
So if it's a chronic ongoing thing and they haven't had any relief from a number of courses of antibiotics, then it would be very important to see an ENT surgeon. So we have a special little camera that actually looks down through the nose to the back of the throat and down at the voice box, and we can tell whether or not they've got problems like reflux, because it changes the appearance of the larynx. We can have a look at the base of the tongue and make sure that they don't have lingual tonsillitis. And we can also have a look in the nose and make sure that it's not the nose causing the problem. So if you have a persistent sore throat, it is important to see an ENT surgeon, especially because very rarely it may be that you have a cancer of the larynx, and we need to have a look at it.
So if you do have any particular ENT issues, you can see our ENT doctors at the E4 ENT Clinic.